Well, welcome to today's A to Z episode where we have Professor Elisabeth Johnson joining us from the European University of Cyprus, EUC. We're very excited to have her here today because she will cover a session on future careers in medical sciences. So without further ado, I will allow Elisabeth to lead the presentation and there'll be a question and answer session at the end as well. Please enjoy this session.
Thank you very much, Guar. Hello, everyone. Basically, this is for you if you want to be a doctor, so you know what it's like to study and what it's like to practice medicine in the future. And when I say medicine, I mean medicine, dentistry, veterinary medicine, the medical sciences. So in the short period that we're going to be together, I'm going to talk to you a little bit about the changing landscape, what is new, the evolution that we're seeing in medicine, and of course its consequences and how we learn medicine today, medical sciences. So medicine has changed tremendously across the ages. You've heard of the agricultural age and the industrial age, which is the golden age of medicine. That's where anesthesiology came out, x-rays, the OR was developed. And then the information age is when the computer started playing a role, where we had digital images, computer-assisted surgery, endoscopy, all of those things that we hear about. Today, actually, we have entered a new age, the so-called fourth wave. And this is where medical science crosses those traditional disciplines of biological sciences, physical sciences, and information sciences. And it's leading to an explosion of new tools and new knowledge of how we practice the medical sciences. So if we were to step back and say, through this decade that we're halfway through now, 2025, we're halfway here and we're seeing this. What are the big three? What are these big trends that we see in healthcare? And when I say healthcare, I'm referring to the global aspect. Big data, prevention versus wellness, and then something that we call patient-centered or precision medicine. What's big data? We're talking about a tremendous growth in health data. And we're using this to benefit how we diagnose, how we integrate, how we make our care more personal, either for our beloved cat at home or our grandma or our grandpa. We're using this information and it's increasing the number of diagnostic tools that we have and therapeutic tools that we have to treat. We're now focused on wellness versus sick care. What am I talking about? In the past, we were always doing damage control. Somebody got sick and they would come in and we would try to make them better. The focus today from our professions, dentistry, vets, and medical doctors, is how to keep people healthy from the beginning. So we prevent them. We try to prevent them from becoming ill. So we're working on keeping them healthy throughout. And then, of course, the third big trend is the new products and health services that we see coming out related to this centralized medicine that allows us to do early diagnosis, precision medicine, and individualized medicine. On top of all of that I'm talking about, we're seeing that medical knowledge is increasing in its doubling time. A little over 10 years ago, medical knowledge was doubling about every 2.5 to 3 years. Just a few years ago, it was doubling 2.5 and 3 months. Today, I'm afraid to say that medical knowledge is doubling almost monthly. It's a tremendous burden of new knowledge. And what does this mean? It means that medicine is going to change more across the next 20 years than it has in the last 2,000 years. Then I'm going to add another problem, which is the problem of plenty. What do I mean? The number of new scientific knowledge articles that are coming out that doctors, veterinarians, and dentists need to absorb is tremendous. Almost 6 million new scientific articles are coming out every year. So this poses a challenge to us. How do we prepare tomorrow's healthcare providers? What do they need to know? do we need to embrace and learn these new technologies, the e-patient, the e-nurse? And for educators, the challenge is, how do we reform our medical education in such a way that allows us to accommodate this increasing burden of medical knowledge, and of course, this new sense of knowledge in the biointelligence age, in this fourth revolution, this fourth wave that we're now living? Well, medical education is changing tremendously. And you'll see as you start searching whatever school that you're interested in, that we're looking at competencies, developing skills, using tools such as simulation that help us develop these competencies and these skills. More importantly, you remember what I said about knowledge changing and this tremendous amount of knowledge that's coming out. So we must teach students to be self-directed in their learning and lifelong learning. When you study a subject like medicine, it doesn't stop when you graduate and you get your degree. It's continuous. It's a lifelong process. So a few words about European University Cyprus, and I'm using this as a way to show you how you become prepared in the future to become a medical doctor. Of course, most universities that you'll be looking at are comprehensive. For example, at the UC, we have 7 schools and over 90 degrees, and everything is sort of close together. We have a comprehensive set of studies in health, medicine, dentistry, vet, but additional 24 programs in the health sciences. And you're going to say, okay, why should I worry about that? What is important about that? Remember what I said about the health turning from sick, and the fact that we have this new merging of sciences in the biomedical age. We need to ensure that there's crosstalk between the subfields, that we're not in little independent silos, but there's a lot of this interprofessional education, which we're able to embrace when we have multiplicity of schools. But let's focus on the medical science big 3. What are the big 3? It's medicine, dentistry, and veterinary medicine. Okay? Now, in medicine, we're lucky enough to have 2 branches, 2 campuses, one in Frankfurt and one in Nicosia. Both campuses, and now our new one in Frankfurt, have state-of-the-art, all-inclusive educational facilities. And you're going to see why this is important in a few minutes as you try to see if you want to develop in this field of medical sciences. Very important is having recognition of your degree. The School of Medicine is approved by the Education Commission for Foreign Medical Graduates, the ECFMG, meaning for those students who want to go to the other side of the ocean, to go to, let's say, the USA or Canada, your degree is recognized, okay? You're able to take the USMLEs. Which is also important for those of you who want to stay within Europe, is that a degree be recognized by the European Parliament on the IMI market, meaning that your degree is like a passport that is able to move across the European continent because it's recognized. How can we achieve this? We achieve this by having an international or a global recognition of the program. So when you look at programs, you want to see that it's accredited, usually through a process like the World Federation of Medical Education, the so-called WFME. This ensures recognition of your degree when you graduate so that you can use it beyond your borders. It's important to look at the reputation. For example, at European University Cyprus, we're very proud that we've received 5 stars, the highest ranking possible, on the QS Stars University ratings in 2024. This is our 2nd time in a row in achieving this. Actually, the entire university has received this overall assessment of 5 stars, as we've received in the subcategories teaching, global engagement, and so on. More importantly, just a few days ago, we were ranked in the top 501 plus in medicine and health. And this is very important when you know that your degree and the school that you're getting degree coming from has an appreciation. Now, for dental surgery, We're the first and only in Cyprus, and you're qualified, again, on the IMI market to practice across the 32 EU and European Free Association members. And the dental program is approved by the Association of Dental Education in Europe. Similarly, our very new veterinary program follows the European system for the evaluation of veterinary training, the ISVET, and like our other schools, are technologically driven and high fidelity simulation is important. So regardless of the school, the aim is to ensure that you become a compassionate and skilled practitioner, that you're able to succeed in any field that you want, and that you're able to provide safe, individualized, either for your dental patient or your animal patient or your human patient, based on sound knowledge, okay? And to work in the multi-professional team. Remember the word that I said, interprofessional education, by having lots of different health sciences around you, you learn about this as well. And of course, hopefully to become a leader tomorrow. So how can you achieve this in the educational environment? That's a tall order that we're asking. One is by having a very high level infrastructure. And remember, we said in order to gain skills and competencies, and to have an engaging curriculum, one that doesn't make you book smart, but gives you the training and the competencies that you need. So when we were challenged with this new scope of how we need to make doctors, we decided to emphasize the integration of knowledge in relation to clinical practice, to make something that was more interactive and that was more functionally and clinically relevant. So the curriculum was redesigned, and we call this a competency-based learning the skills, integrated spiral curriculum. What does that mean? It's a big series of words. Basically, in here I'm showing you medicine, but it's the same across the board. And this is a good type of curriculum to become a good doctor, dentist, or vet, is that you constantly build on previous information. So you start out with foundations. What are these foundations? It's the biochemistries, it's the biologies, it's the basic anatomies, the basic physiologies. You learn about a system in health, be it the oral system if it's a dentist, the animal system if you're a vet, or the human system if you want to be a medical doctor. So you learn about the body in health. And then you go through a second phase, which are the foundations of clinical practice, where you start learning what can go wrong. How does the body respond in disease? What is the process? And then, of course, this prepares you for that final phase when you're out there learning how to practice as a dentist, a vet, or a clinician, the clinical training. So what are the cornerstones of these types of programs? What makes it function? Active learning. You're going to say, well, Dean Johnson, why would I want to say active learning is important? Let me give you a piece of information. If I gave you only lectures, which is a very old school way of teaching, you would retain less than 1% of the information. If you're actively involved, that is, you're doing something physically in the lab, you're practicing, you retain over 75% of what you're learning. So focusing a program to be active learning is extremely important. Critical thinking. Why would I want to stress that critical thinking is important? Remember what I said about the growth of medical knowledge. So learning how to think is extremely important in being able to become a competent clinician. Early introduction into medical practice, making what you're learning relevant, and using the new tools that are made available to us in advanced medical education. And I'll be stressing this a little bit more as we go on. So what is the early introduction to medical practice? This means that you're exposed even from year one, what you're learning, how it relates to what you're going to do in the future across the board. So you get to see your first exposure to a hospital in year one, or to the dental clinic, or to a veterinary practice and handling an animal, and how you learn to handle the animal. New technologies. Technologies have changed, and even in education, and we want to embrace these technologies. So, for example, in dentistry, we have haptics. You're going to say, okay, what is a haptic? You can see it in the center of your screen, top center of the screen. It's a machine that you're looking in with goggles, and you have your hands in the system. And what you're touching actually feels like you're in the mouth of a patient. Why is this important? Because you get to practice your hand-eye coordination before you actually are with the patient. These are expensive technologies, but they're extremely valuable in preparing you for the clinical field. And of course, are the task training and simulation. And I'm going to be explaining these as we go a little bit further, because learning specific tasks that you're going to be using as a clinician, skills, or simulating a clinical environment are very, very important to prepare you before you make it to the hospital, to the dental clinic, or to the vet clinic. So, for example, in our School of Medicine, we have a high fidelity simulation complex, outpatient rooms where you learn how to talk, procedure skills, the task training, as well as even a standardized hospital. It is not a real hospital, but it gives you the sense of being in a hospital and how you interact. And actually, these have received international awards for best educational installations, as well as best medical institution. So what is a task trainer? We use task trainers across the board, dentistry, vet, and medicine. This is where you learn a specific skill. For example, how to put an IV line. First time you want to put an IV line in your patient, be it a horse, a dog, or a human, your hand is going to shake. You're not going to know how to find the vessel that you're looking for. So we let you practice this skill over and over and over before you make it to the hospital. Simulation. Here I'm showing you human simulations, but we have it for animals and also dentistry. You're equipped, it's like a hospital room. It's like what you will see in the clinic with everything there. So you're able to see the environment of what it's going to be like the first time that you hear a cardiac arrest and all of the buzzards are going off and everything. You learn how to work in a team and you learn how to respond. Let me show you a short video about how simulation works in training at EUC.
Hello everyone, I'm Dr. Aris Angouridis. I am here with my team, Philippos, who is a nurse, and Eleana, the midwife. We are at the final stages of delivering a baby from a very advanced human patient simulator. Her name is Victoria. Victoria, as well as the rest of our simulators, look and act like real patients. As you can see, we are in a room that is exactly like a real hospital room with all the equipment and monitors that you would normally expect to find there. And everything we see in the monitor has been programmed in a way that shows exactly what happens with every action we take, either correct or wrong. We have several simulator rooms with different mannequins. With each simulator, you are given the chance to practice real-life medical events or scenarios like delivering a baby, which we are currently performing here. So, what do we do here at the European University Cyprus? We guide you through this clinical experience as if it was a real medical event in the hospital. With this process, you learn to diagnose and treat patients, but more importantly, you learn from your mistakes before you deal with a real patient. At European University Cyprus, you practice on simulation from the first year of your studies. And by the time you get to the clinical training, which is in year 4, you will be experienced in a really wide range of medical scenarios. We are now in our simulated hospital world, where we have set up some of the stations we use to train our students to do various clinical skills. If you look around, you see exactly what you would see in a real hospital world, including all the equipment, even a nurse station. As you can see here, for example, Pani She's performing a heart ultrasound. Under our guidance and predefined scenarios, she's learning how to do an ultrasound and actually recognize any normal fractures or any pathological findings. Further down, we can see Eleana, who is trying to insert a vein catheter. We have several other clinical skills, like here Philippos, who is trying to intubate a patient. Furthermore, you can also practice on urine catheter placement in male and female models. Mastering these clinical skills is very important, as it offers you, our students, a significant advantage when you are exposed to patients in hospitals and clinical practice. In other words, we provide you with a safe and controlled environment to practice basic and advanced skills before you start your clinical rotations in the hospital.
So the point is that you can learn basic and advanced skills, as you heard Aris talking about, and you can learn how to make your diagnosis and treatment in the simulation complex. Above all, you can make your mistakes safely so that you don't harm your patient, be it a dental ward, be it the animal ward, or be it in the clinical ward. So the key features of any program that is going to allow you to practice safely medicine is early patient contact, multiple teaching methods, and of course, student support throughout, active learning and critical thinking, active hands-on learning, and early introduction to your medical practice. Clinical training networks are very important across the board. For example, in medicine, yes, you need to see primary care, inpatient, outpatient. You need to ensure that you're being exposed to whatever you may come up across in the future. We're becoming more global, so our clinical training network should be more global so that a student can get exposure to things in various countries to see what the options are. Actually, you can see here at EUC, besides Cyprus and Greece, we have hospitals that we work with in Germany and France, the USA, even Tanzania. It's part of our global outreach. Dentistry is a little bit different. Dentistry has its own in-campus dental clinic where they serve over 4,000 cases annually, including immigrants. So you're constantly in the clinic from year one, learning to practice, learning to do your skills. Vets is a little bit different. In veterinary medicine, yes, you need a small animal clinic so that you can see the surgery and practice in the surgery, anesthesiology, diagnostic imaging, the whole gamma of treatments that you do for a small animal. But a good veterinary program needs to give you a global experience so that you can see farm production, sheep, goats, cattle, swine, equine, horses, so that you can see how these are monitored and taken care of. You become part of animal food and pharmaceutical production. It's a very important part of the veterinarian's role, as well as public health in monitoring. So these are all critical parts of becoming a veterinary doctor today. And whatever program you choose needs to provide you with a hands-on experience, real experience across the board here. But is that enough? You need to be supported throughout your studies. So yes, there are advisors, the registrar's office who tells you what to register, but there are academic and clinical advisors who are your go-to people when you have problems. Looking for this in a program is extremely important. And this is something we're very proud of at EUC, to hold your hand and guide you as you develop through. Is that enough? No. Remember what we said, global training in medicine and whatever. We believe that the profile of the student needs to be exposed to what's happening in the world. And we're a global unit. As we go. This is the diseases that are coming out. So in the summers, you should look for places like EUC that have an externship network that give you experience across the board so that you can explore perhaps what you want to do when you graduate as a specialty. For example, we offer externships at Brown, at Oxford, at Shriners Hospital, even in the laboratories of Nobel laureates like Hanover or Ada Yonath. Can you imagine what it's like to put on your CV when you graduate that you spent time in the laboratory of a Nobel laureate? But nothing is more international than a disease. So as you explore where you want to go, look to see the faculty. Are they involved in policy making, national policy, international policy? What are their roles? This is very important and something that we're very proud of our involvement both in national and international policy, but as well, not just healthcare, but healthcare education. For example, the International Network for Healthcare Workforce Education looks at how we should educate vets, how we should educate dentists, how we should educate tomorrow's nurses or doctors. And yes, we're partnered with the INWE, and actually I'm very happy to remain the dean, the president of the board. What kind of footprint does your projected school have when you're looking? What kind of involvement do they have? What is their academic or scientific profile? For example, we have a meeting that we host every year. We bring in a lot of Nobel laureates coming in. Many of these have agreed to become honorary faculty for us, providing insight lectures and so on and so forth, as well as serving as our graduation keynote speakers, which is very, very important. But let's step back. You just learned that to become a doctor, you need to look at a few things, and basically there are a lot of skills and a lot of knowledge that you need to acquire. Do we want you to be book smart? Yes, to a certain extent. Do we want you to memorize a book? No, that doesn't make you a good clinician today in face of the challenges that we have. So when you decide that you want to apply to be a vet, to be a dentist, to be a medical doctor, what should you consider? The location of the university, very important. The campus, is it together? Does it have a reputation? But more importantly, what kind of program does it have? Type of program, 5-6 year. Teaching style, are you thrown in a big auditorium with 400 students, or are you given the chance to do hands-on lab training in small group? Do they emphasize skill acquisition, competency acquisition? Do they give you any choices? Do they have externships? Do they provide exchanges? Do they give you a chance to be exposed to research? And of course, what's the curriculum? Do they have patient contact? Does it make sense? Are you developing your skills? These are the things that you need to question and consider when you're considering where you want to go to school. Of course, other things when you're looking at the university is the teaching programs, if they're innovative, student-faculty ratio, research and externships, the curriculum, health and wellness facilities, campus safety, career services, so on and so forth. A lot of things. When you decide, let's say you decide you want to do medicine. I'm partial since I'm the dean of medicine. What is the journey like? Well, the beginning is the so-called convocation. You have an orientation. So you learn what the program is about. You learn what being a doctor is about. We talk about all of this. And then there's a very important ceremony. It's called the white coat ceremony. You're given your first white coat. The symbolism here is that the faculty member puts your white coat on and says, I'm going to teach you. I'm going to train you. You're going to be with me side by side for the next few years. And you say an oath, not the Hippocratic oath, but it's an oath pledging your dedication to the ethics and standards of learning the art of medicine. And you go through those 6 years with your competency training, your skills training, your clinical training. And when you come out, you reach commencement, the graduation ceremony. Here, you're given a hood for your regalia. That nice colorful velvet band that goes around you and comes from the back. This is called hooding. And you're hooded by the faculty. Why is this important? They gave you the white coat and they said, hey, I'm going to teach you. I'm going to train you. And now they're saying, I taught you. I trained you. You're now my equal. And this is where you sign the Book of Graduates. This is the first time that you sign your name and you use the initials MD afterwards, medical doctor. Now you can. And of course, this is when you say the Hippocratic Oath. This is where you do truly become a doctor. So the question is, for each and every one of you, is what will your journey be? What do you want? And there's always ample of choices of becoming a good medical sciences graduate and attending a good medical sciences school. So thank you very much for your attention. And I'm going to stop sharing my screen and go back to Guar, who I believe has a few questions for me.
Professor Elisabeth, thank you very much for the very, very insightful session there on medical sciences. You covered a lot in terms of medicine, dentistry, veterinary sciences, and I'm sure we have many budding medical sciences scientists amongst our student population as well. You mentioned the competency-based integrated spiral curriculum, and I did write that down to make sure I had that correctly. It's really interesting for us from an ISP perspective, looking at, you know, the K to 12 population of students. And ultimately, my question to you here is, what kind of competencies can students in school today start to develop in order to hopefully follow a path in medical sciences?
That's a very good question, and it's a difficult question. First of all, a solid, you saw what I was saying about the biointelligence age, the merging of knowledge. So a good breadth of background knowledge in biology, computer science, all of these are very, very important in becoming a strong candidate and actually successfully navigating the challenges. But hands-on experience comes through your volunteering, maybe going to a doctor's office. It actually is helpful in many ways. It gives you some hands-on experience, but it also gives you a sense of, is this something I see myself that I can do in the future? Do I really like it, or does it just sound good? Because one of the things that we look at is somebody who understands what they're getting into. When we do an interview, most of our applicants are very, very good. And I know I'm straying, but I think it's part of the global question. All students are very, very good. They come in with good grades. But is it enough? Are you aware of what you're doing? Are you passionate about it? Do you show empathy? And empathy comes with experience. So that's why I say if you can go and visit a doctor's office or go to an animal shelter if you're interested in veterinary medicine, or sit in with a dentist, it gives you a sense of how do you talk to somebody. Teamwork. And teamwork is something important, and especially in sports. It's something that in sports shows people how to work in a team, to share. And often we say, can you give us an example of how you work in a team? And most of the examples do come from playing basketball or soccer, whatever, how you give a lead to somebody else. Are you a leader? Are you a follower? These are things. So exposure is the bottom line and the most important thing, so that a student realizes that this is really what they want to do.
Yeah, and that is a key word throughout this A to Z speaker series in terms of, you know, giving children exposure earlier on, because it's not necessarily all glamorous becoming a doctor or a vet. You know, there are lots of things happening behind that scenes. You also mentioned kind of, you know, the embracing of new technologies, and mentioned your simultaneous complex. You know, at ISP, we have, you know, we consult on multiple frameworks globally to build our own life competencies framework, which is really, really exciting. So we look at, you know, cognitive and critical skills, which you mentioned. We looked at, you know, looking at, you know, building global citizens, digital competencies, self-leadership, interpersonal kind of skills.
Very important.
Which you've mentioned, but looking at the tech side, you know, what kind of skills or competencies would they need to embrace? You know, not necessarily the technology today, but the technology in maybe 10 years'
Tomorrow,
time?
actually, I think what's more important, tech skills are very important, being computer literate, and all of them are digital natives now, and I don't need to say it. They know. I go to the younger individuals, and they come up. We're embracing AI in our teaching, and a lot of the ideas come from our students. I think what's more important is learning how to be self-monitored and self-learning. Something that I said a couple times is that vast amount of knowledge. And being a good clinician doesn't mean that you memorize everything, but you know where to go to look, and that you're able to think through, and you're able to say, I don't know, but I know how to find out. So for me, that's a more critical skill and more important for successfully becoming a good clinician and successfully navigating the challenges of going through medical school, or dental school or vet, because those little hands-on we learn, and they change. They do change. And today we're doing this, and tomorrow we're doing this. And the problem is, I don't know what's going to change. I can teach you something today, and in 5 years it's obsolete, but I don't know. So being able to think and not learning by memorization of a lot of details is the most important thing that we can stress. And exposure, like we were saying, to see that, yes, I like this, I really want this, or you know what, maybe I don't want dentistry, I want vet, or maybe I want to do something else.
Yeah, indeed. And you did mention, the medical knowledge increasingly becoming, a problem of plenty for, for students and doctors and medical practitioners today. So how about looking into the future in terms of, the kind of roles that will be emerging in the field of medicine, veterinary science, and dentistry? I know that's a big, big question. But in
It's a
20
big
years,
question.
yeah. In
Yeah,
20 years' time, what kind of roles will there be?
I'm telling you again, something that I hinted to, but I'll make it more hopefully lucid. We're talking more about global medicine, global doctors, and even the new trend of One Health. One Health does what? It brings them all together. After the pandemic, we realized how important it is, this interprofessional communication. And One Health leaders are the people who look at veterinary medicine and clinical medicine, dentistry and medical all together, because they're joined. I get diseases from animals, and I give my diseases to animals. And how do I control this? So this is something that's not going to go away. It's a major cornerstone, but also being more global, that understanding that healthcare, let's say in Tanzania, and healthcare in Norway or in the UK or whatever, have different nuances, and to understand that. So I think the challenge, and the new doctor is going to be a doctor who is aware of how these combine, how they come together. And the word global doesn't go away. The fact that being able to take your knowledge to be able to effectively perform and take care of a sick child in Tanzania, who's coming up with a disease that you've never heard of, or understanding the relationship between what a vet will see and what you're doing.
Yeah, okay. So global is the key word there.
It's a
Um,
big word.
and I did like, you mentioned quite a few times the interprofessional element to the role as well. So it's not necessarily about specializing in that one discipline, and it's being kind of open to collaborating with the other disciplines as well. And yeah.
Yeah, no, exactly. The IPE, interprofessional education, is actually a cornerstone in new education. And why? Let's say I'm a surgeon. I have to talk to the pathologist who took the sample to tell me what's happening, to the nurse, to the anesthesiologist, and each one has a different role. When I'm in a critical ICU and somebody is having a cardiac arrest, each person in there are coming sometimes from a different discipline. So they need to be able to work together. So this part of becoming one team is extremely important. And that you develop that by being exposed to what the others are doing.
Yeah.
So yes,
Okay.
it's a big thing.
Yeah. Okay. So just as a final question to you, and then I think this might be quite a broad question as well, and you have answered it in your previous questions, I think. But if you were to give parents one piece of advice, instead of just exposure to the different kind of disciplines, what would it be to support their child who's looking to become a doctor, looking to become a vet, a dentistry, or looking at alternatives as well within that field?
This is a very, very important question. And I understand that many times we are very happy when we see our child who wants to become a dentist or a vet or a clinician. The exposure helps the young individual discover if it's something that they really like. And this is important, but they need to feel free to explore other avenues, so that perhaps maybe they prefer research, or they prefer art, or they prefer music, or they prefer they're a computer whiz. I've seen students come in with a burden sometimes that I need to become a doctor, and you see that sometimes they're very unhappy after a year or two, that they don't have not the ability, because I believe every student has the ability, but they don't have that drive to do it. And it does take a drive to succeed. It has to be innate. They have to want it. So it's very important that the student feels, the young individual feels it's their choice. They're in control. And this is the most important. This is what makes a successful graduate, that they drove, they wanted, this is what they want to do. And we actually look for that when we're doing the interview. I know that it's hard, especially when mom and dad are clinicians or vets or whatever, that I need to do it too. It's important for the child to feel that they can explore other avenues. And when they ultimately decide that it's their choice, and we're there to support them. So yes, exposure so they can figure out what it is they want, but it has to be their choice.
Yeah, and you did mention earlier on the word passion. And I think that's key as well. If there's no passion, then the likeliness of success is probably a bit more challenging. I think, if you're passionate about the work that you do, then obviously that will help lead to success as well. Okay. Thank you very much for your time. I do really, really appreciate it. Thank you
Thank you.
so much.
It's a pleasure being with you. Thank you.